Welcome back to Toledo Clinic TV. My guest is an allergy and immunology specialist, Dr. Binod Thakur. Thank you for being with us. Tell me exactly what it is that you do at your practice.
We take care of patients with chronic, complicated, severe, recurrent allergy and immunology problems, such as recurrent sinus infection, chronic persistent sinusitis, moderate to severe asthma, difficult to control asthma, and other lung issues, severe, moderate to severe eczema, recurrent urticaria, which are hives, localized swelling episodes like tongue swelling, throat swelling that can become life-threatening, people with episodes of anaphylaxis, which is life-threatening, severe allergic reaction when people go in shock, different kind of skin allergies other than eczema, contact reactions, chemical sensitivities. We also take care of people with recurrent infections, recurrent pneumonia, bronchitis, or severe infections, unusual infections, atypical infections. We do immunological workup for them to see if there is an immunological basis for their problem.
So when most patients come to you, they're already sick, they're already showing symptoms of something.
Yes.
Okay. And how, I know you mentioned a whole host of ailments, but are most of them easily treatable?
Most of them are treatable one way or other.
Okay.
And preventable. We are very high into preventive and holistic approach. So once we identify the allergen, if a specific allergen is identified, in many cases, just by preventing exposure, they would not need extra medication.
Okay, so a person would come to you if they're having a reaction, and you would do some pretty comprehensive allergy testing. What are you looking for exactly?
It depends upon their presentation and symptoms. People with sinus problems and asthma, we will initially look for environmental allergies, pollens, dust, mold. If somebody comes with food-related reactions or rashes that are induced by certain food or unidentified food, then in that case we would do food allergy testing. If people are having episodes of unexplained allergic reaction, then they might need certain kind of blood test or allergy test. For skin chronic eczema, we do contact allergy test for contact allergy that involves many different kind of chemicals that one comes in contact through personal care products, clothing, and many other things, preservatives.
So you're able really in many cases to eliminate the problem by eliminating the source?
Yes, if you identify the problem, you can in many cases eliminate, and then you don't need to keep filling up the prescriptions.
Right. And you do allergy shots too for those who need them?
Yes. Many allergies can be desensitized, not all, but allergy shots are highly effective for pollen allergy, ragweed, tree pollens, grass pollens, for dust mites, for cat, dog, and other pets. Several molds will respond well to allergy shots, and it is highly effective in people with stinging insect allergy, those who have had life-threatening reactions to bee, wasp, hornets, yellow jacket. Those can be desensitized with very high percentage of success rate.
Is it possible to outgrow allergies?
Yes, some people do outgrow their allergies.
And is there a way to determine whether that's the case? For you can say, oh, just.
It's difficult to predict beforehand. However, we have noticed the trend that in last 20, 30 years, allergies are becoming more common. Fewer people seems to be outgrowing it, and it is becoming more severe than it used to be.
Do you have any idea why that might be the case?
There are many different hypotheses about it, whether it is weather change, whether it is change in lifestyle. There are lots of data to suggest that as countries get more westernized, rate of infections go down, but rate of allergies go up.
Okay. Does
But
it have something to do with what we're exposed to when we're young, perhaps?
Yes, and what we are not exposed to.
Okay, that makes sense. All right, some good information. Thank you so much,
Thank
Doctor.
you. Thank you.
And we'll be right back.